Welcome to madness. Tension, tension, tension. And it becomes hypertension. Let's see what it is. Hypertension is elevated or increased blood pressure. Before we go deeper, let's have a look what is blood pressure. It is basically the pressure exerted by the blood on walls of blood vessels. Less than 120 and less than 80 millimeter of mercury is the normal value of blood pressure. Here comes a question. Why is mercury used as a unit? The answer is mercury is sensitive to pressure and temperature changes. That's why we use it in temperature and pressure measuring devices. For example, in thermometer, liquid mercury rises according to the body temperature. 120 represents systolic blood pressure and it is the pressure inside blood vessels when heart contracts, or we can say when heart squeezes. And 80 represents diastolic blood pressure, which is the pressure inside blood vessels when heart relaxes and fills up with the blood. Systolic blood pressure depends on cardiac output, and diastolic blood pressure depends upon total peripheral resistance. In our body, heart is an organ which supplies blood to every cell and tissue in the body. Increased cardiac output results in more blood coming out of the heart chambers into aorta, which is the largest artery in body, raising systolic blood pressure. Hence, cardiac output and systolic blood pressure has a direct relation. Now, let's jump in to see the factors influencing diastolic blood pressure. As we have discussed, that systolic blood pressure depends on total peripheral resistance or TPR, which is defined as the force exerted on circulating blood by the vasculature of body. So, we can say blood vessels will experience resistance when they will contact with the walls of blood vessels. First determinant of peripheral vascular resistance is diameter of blood vessel. This is the normal state of blood vessel showing diameter or available space for blood to pass through. If this area is reduced, or we can say if we reduce the diameter, space for the blood passage will become narrow and it will be termed as vasoconstriction. And ultimately, pressure will increase and resistance will be higher. And if we increase the diameter, space will be wider for the blood flow and it will be termed as vasodilation, and the pressure of blood will be reduced and will experience less resistance. Hence, we can conclude that vessel diameter is inversely proportional to the resistance of vasculature. Second determinant of peripheral vascular resistance is blood viscosity. Less viscous blood, which means blood with less blood cells, will experience lower resistance as compared to blood with higher viscosity, which have more blood cells. Thus, we can say that blood viscosity is directly proportional to vascular resistance. Third determinant is vessel length. Longer vessel will provide more area for resistance as compared to the short length. Hence, vessel length is also directly proportional to resistance. Seventh report of Joint National Committee, that is JNC7, has categorized hypertension. Normally, an adult should have systolic blood pressure less than 120 and diastolic blood pressure less than 80 millimeter of mercury. Pre-hypertension state has systolic blood pressure ranging from 120 to 139 and diastolic blood pressure ranging from 80 to 89. At stage 1, systolic blood pressure ranges from 140 to 159 and diastolic blood pressure ranges from 90 to 99. Let's jump in to see what's happening at stage 2. Here, systolic blood pressure is greater than 160 and diastolic blood pressure is greater than 100 millimeter of mercury. Hypertension can be classified in another way as well. primary or essential hypertension, and secondary hypertension. In primary hypertension, there is no specific cause or etiology, while in secondary hypertension, it is associated with some other cause like diabetes or some kidney problem. Now, let's talk about regulation of blood pressure. Our body has mechanisms to cope with the changes in blood pressure. One of the regulatory mechanisms is baroreceptor system, which is linked with neuronal response. It acts immediately and provides a short-term regulation of blood pressure. The second coping mechanism is renin-angiotensin-aldosterone or RAS system, which revolves around kidney and adrenal glands which work together to control blood pressure. Onset of this system is delayed or late and provides a long-term regulation. Baroreceptors are mechanoreceptors which are present in numerous body vessels such as carotid artery and aortic arch. They are stretch receptors which are sensitive to changes in pressure of blood flow. When blood pressure raises, the baroreceptors send message to the brain that causes decreased sympathetic nervous system activity and increased parasympathetic response, which in turn leads to a decrease in heart rate, vasodilation of blood vessels, and ultimately a decrease in blood pressure. While in case of low blood pressure, the baroreceptors send signals to the brain that results in increased sympathetic activity and decreased parasympathetic activity, which leads to an increased heart rate and vasoconstriction of blood vessels, resulting in increase in blood pressure. If the system fails to work, it can contribute to various medical conditions such as hypertension, orthostatic hypertension, and heart failure. Now, let's hover over renin-angiotensin-aldosterone system, which is responsible for long-term blood pressure regulation. This system is linked with liver, kidney, and lungs. When blood pressure falls or decreases, kidneys release renin enzyme, which then converts angiotensinogen, a protein produced by liver, into angiotensin 1, which is inactive. It is further broken down into angiotensin 2 by ACE, means angiotensin converting enzyme, which is released by lungs and kidneys. Angiotensin 2 is active and stimulates adrenal glands to release aldosterone. Aldosterone is a hormone which is responsible for reabsorption of sodium chloride and water. Angiotensin 2 has important functions to regulate blood pressure. It causes vasoconstriction. That means it will reduce the diameter of vessel and will increase the blood pressure. Another function is to activate thalamus to induce thirst, which will add up blood volume, thus increasing the blood pressure. Last but not the least function is to stimulate pituitary gland, which will release antidiuretic hormone ADH or vasopressin, which will reabsorb water in order to maintain sufficient amount of blood volume and hence blood pressure. That was all for today. Stay tuned to Madness and don't forget to like and subscribe the channel. Welcome to Madness.